welcome back to my channel, and this is the third part of the abdominal complaints. The first part was for chronic abdominal pain, the second was upper abdominal pain, and this is the last part, lower abdominal pain. So again, my name is Gia and welcome back to my channel. So I'm your friendly family nurse practitioner here to talk to you about lower abdominal pain today. As I already mentioned, an abdominal pain complaint can be intimidating because it covers a whole lot, right? You can have a broad differential diagnosis. So my hope is after this video presentation, you feel a little bit better as you see a patient with this complaint. All right, let me start. So I always start with red flags, right? Because you want to make sure the patients, you're not keeping these patients in your clinic and you're transferring them over to higher level of care. And so severe abdominal pain and abnormal vital signs, persistent vomiting and peritoneal signs, guarding, rebound tenderness, and fever. And so your differential diagnosis for this, patients coming in with the red flags is going to be acute diverticulitis, appendicitis, mesenteric adenitis, colitis, ischemic bowel or mesenteric, strangulated hernia, your AAA, pyelonephritis, ovarian torsion, PID, ectopic pregnancy. Okay, so transfer your patient to emergency for prompt evaluation and treatment. Okay, if your patient coming in with lower abdominal pain without the red flags, so you're gonna consider in your differential diagnosis ulcerative colitis, Crohn's disease, early infectious etiology, cystitis, retroperitoneal abscess, ovarian torsion, herpes zoster. All right, so you can also consider inguinal causes, including testicular torsion. Remember, you're gonna do a due diligence in your history taking, right? Your HPI. So your workup. ED referral if patient has red flags and peritoneal signs. No questions, just send them over, okay? Because you don't want to delay treatment. And so for those that do not have the red flags, you can do HCG because remember, ectopic pregnancy can also present with lower abdominal pain, CBC, CMP, lipase, ESR, urinalysis with reflex to culture. You can add in lactic acid and procalcitonin if you're comfortable, but the bare minimum is gonna be the first 6, okay, with or without lactic acid or procalcitonin. Imaging is going to be abdominal ultrasound, okay, especially if the patient is of childbearing age, okay, and you can do CT abdomen without contrast if the patient is not of reproductive age, and contrast only if the creatinine is equal or less than 1.3, as long as the creatinine is normal. Okay, and you consider pelvic exam with bimanual exam, cultures for gonorrhea and chlamydia, depending upon your patient risk factors. But I would just do it just to be on the safe. So if the patient has chronic lower abdominal pain and female of childbearing age, you obtain urine HCG to rule out pregnancy. Okay, if the pain is cyclic, the pattern is cyclic, you can consider in your differential endometriosis, ovarian mass, fibroids, or Mittel's MERS. If non-cyclic, your differential should include IBS, PID, interstitial cystitis, and or ectopic pregnancy. Your workup is going to be this, depending upon the result of the urine HCG. If it's positive, you can add in quantitative HCG. CBC, work them up for celiac disease because you want to rule this out before you can consider IBS. UA with reflex to culture, your gonorrhea, chlamydia, pelvic exam, wet mount for GC, chlamydia, and trach. Imaging is gonna be abdominal ultrasound. Okay. All right. Chronic pain, and the patient is not female of childbearing age. Your differentials will include chronic diverticulitis, colitis, ischemic bowel disease, IBS, adhesions if patient had past abdominal surgery. And you also can consider psych because, like I mentioned earlier or in the previous video, this could be a psychosomatic manifestation of depression or anxiety. And look for any trauma such as domestic violence. Your workup will include CBC. Again, work them up for making sure they don't have celiac disease, urinalysis with reflex to culture, and lipase. Your imaging is you're not concerned about pregnancy, so you can do CT of the abdomen and pelvis with and without contrast. Contrast only if the creatinine is equal or less than 1.3. Okay? Alright guys, thank you so much for listening to me, and I hope that you found this video helpful and reinforcing. Remember, this is only a review of in addition to what you have already learned from school. And again, my reference is the 5-minute consult and my experience as well. So I'm so excited to share to you more tips and tricks I learned from my practice, and I am enjoying this process because at the same time I'm also reinforcing and relearning the things that I have learned in the past. Remember, repetition is the mother of learning. Alright, so feel free to leave a comment if you want to talk about some specific diseases or symptoms that you want me to go over. So sending you lots of encouragement, inspiration, motivation, because you are a wonderful family nurse practitioner. I'll see you next time.